Perfect. So hello everyone, my name is Julia. I am an audiologist at Bay Audiology, if you can't already tell. So I was born in Korea, but I came here when I was 1, as you can tell from the accent. So what we'll be talking to you about is the relationship between hearing loss and cognitive decline, and seeing whether there is a relationship there. So what we'll talk about first is presbycusis. So does anyone know what presbycusis means? No? Age-related. Yes, good. Yes, exactly. So presbycusis is age-related hearing loss. So what it is it affects, so our ears make up of outer, middle and inner ear. It primarily is affected in the inner ear. So that is affected by the hair cells. So once our hair cells start to degrade, that causes that hearing loss. So why this happens is because in our cochlea, it's just like in the strings of a piano. It starts in the high pitches first and then goes down to those lower pitches. But as sound travels through, it has to always pass through the base of the cochlea. So natural wear and tear does affect the high pitches, which means like th, s, k, and sh types of sounds are usually affected. So what people usually notice is that one-to-one conversations like this, you probably won't notice too much of a struggle there, but it's as soon as you're in a busy restaurant or a cafe, or if someone's talking to you from far away and they've got their back turned against you, that's when you'll start to notice that there's a bit of a difficulty there. And otherwise, people don't really know this, but hearing loss is quite prevalent. So in the World Health Organization, 1.5 billion people were identified with having hearing loss worldwide. And of that majority, around 880,000 people have hearing loss in New Zealand, which is approximately about 18.9% of the population. Yeah, and so the prevalence definitely, as we get older, gets up with age. So as we can see, in the mid-40s to 50s, in 2022, it was around 11%. And as we go up to our age group of 75 and over, we are seeing it rises up to 36%. Yeah, so what are the impacts of not treating your hearing loss? So it's not about just not being able to hear conversations. So I'll relate this to the Māori model of Haura, so the Te Whare Tapa Whā, where our well-being is a meeting house and has 4 pillars of the spiritual, physical, mental and emotional, and our social. So to start off, how it affects our physical is that if we're having these conversations, and of course we start to get tired if we're not hearing as well. So this increases the stress response from the amount of effort we're putting in, which means that, of course, we start to feel a lot tired after those conversations. And how does this affect our social situations? So we start to lose confidence in ourselves that we're going to be hearing as well in these situations, which means that we do feel that frustration emotionally, and we start to feel also embarrassed during conversations if we do get things wrong from time to time. And to cascade, also it affects our social relationships as well, because if we're starting to notice that we're not really liking going out to meet your family or to socialize with your friends, we start to withdraw ourselves from those situations, which can mean you get, it affects you in the way that you do feel loneliness if you start to withdraw socially. And how this affects us spiritually, so if we're withdrawing socially from all the community that we do have, then we do notice that affects the person's sense of belonging and identity. Yep, so what is cognitive decline? So our cognition pretty much relates to just natural processes that our brain uses every day. So this includes language, memory, attention, needing to make plans. All of these are pretty much what our cognition is. So what happens with, as we age, those processes start to slow down. But what happens is with cognitive decline, it is when it degrades in a way that goes beyond just regular age-related effects. So some examples include memory loss, so forgetting to go to your appointments, for example, or when you're really having difficulty concentrating on some tasks, or our language comprehension and retrieval. So if we're trying to constantly find those words because we don't remember what they were, or our reduced planning ability as well. So of course, cognitive decline is also in a spectrum, so it can go from mild cognitive impairment all the way to dementia, but the most important thing is dementia is not a normal part of aging, and that's why researchers are continuously trying to find why and what things we can do to reduce the risks of dementia. So is there a link between hearing loss and dementia? It is pretty much a very widely researched subject now, and what studies have shown is there have been a strong association between them. And people with hearing loss have been shown to be more at risk of developing cognitive problems than people who don't have a hearing loss. But of course, the most important thing to note is that association doesn't mean causation. So what this means is hearing loss doesn't cause dementia, which is very important to note. Yep, so in this graph, so what this pretty much is all the different factors and risk factors of what dementia is, and separated into age groups. So very aggressively in this red graph here, so we see that in mid-ages there's hearing loss, which means that if we do eliminate that hearing loss, we're seeing that it is the #1 modifiable risk factor. So if we reduce this, we can reduce its prevalence by 8% in people with dementia. So some theories about why this might be, the first one being overdiagnosis. So of course, lots of people do use screening tools such as the Montreal Cognitive Assessment Tool and the Mini Mental State Examination. So these rely heavily on spoken instructions and verbal response. So of course, if you aren't able to hear what that question was, if you start to get it wrong, if the question was wrong and you hear it wrongly, then what happens is you give a wrong response. So that's what this came about because Jorgensen did a study with 125 people, young adults with normal hearing, and what they did is they separated them into 5 different hearing categories to simulate hearing loss. So of those people with simulated mild to moderate hearing loss, 16% was misdiagnosed with dementia. So while this can lower the scores of your cognitive assessment, it doesn't really explain fully on why this might be. So some other theories are also the common cause theory. So rather than hearing loss being a cause of dementia, rather it is both conditions arise from a shared aging process. So for example, vascular disease, chronic inflammation and neurodegeneration are both causes of each of them. So rather than hearing loss as an early marker, hearing losses as an early marker rather than a cause of dementia. Otherwise, social isolation theory. So if you start to withdraw from these conversations, then of course you get increased loneliness, and then you're reducing that amount of brain stimulation as well. So these are actually both known risks for dementia. And otherwise, another one is sensory deprivation theory. So what this essentially means in layman terms is if you're not getting stimulation from your brain, they start to weaken, they start to change in shape and also size. So what studies have actually found was that faster rates of atrophy are seen in areas responsible for language, memory, speech and hearing if you do have hearing loss. So one of my favorite theories, so the cognitive load theory. So what this is that the more you're trying to focus in on these conversations, the more energy you're trying to put into listening rather than actually retaining that information. So what really happens when we have hearing loss? We're constantly just trying to catch up to what people are saying. So did they say I look grey in this top or great? Or did they say I need to think about something or do I need a drink? So it's really about that you're really trying to focus in on what people are saying rather than using that energy into memory, for example. So the more effort you're putting into listening, the more cognitive resources for hearing, the less resources for things like memory and attention. So that's why lots of studies have also seen that the more cognitive load you're putting into hearing, the more that you're putting into, it contributes to cognitive decline. So what a lot of people come and say when they sit in my clinic room is, I don't think my hearing loss is that bad, or I think my hearing is normal for my age. So what we really want to know is what constitutes as that bad. So what we saw in a study by Frank Lin and his colleagues in 2011 was that people with mild hearing loss showed to have 2 times of a higher risk of dementia. People with moderate hearing loss were 3 times more likely to have dementia, and otherwise people with severe hearing loss were 5 times more likely to have dementia. So of course, again, just because we are seeing that there is an association does not mean it's a cause. But we are seeing that even people with mild hearing loss show to have a higher risk of dementia than people with normal hearing. Yep, so what can we do about this? So hearing aids have shown to lower the risk of dementia. So what we saw was that if we're hearing well, then of course we're not putting in as much energy into these conversations. So what that means is less effort into conversations, and since we're enjoying these situations a lot more, we're also preserving our social connections with our friends and family, and we're engaging more in our social life as well. So a study showed that people who are more at risk of dementia actually showed a 48% reduction in cognitive decline if they were fitted with hearing aids compared to people who weren't fitted with hearing aids. So what can we do about this? So the most important thing is that when doctors, before they do cognitive assessments, it's important to understand what their hearing loss also looks like, or if they do have a hearing loss, what that looks like. So what this means is that we can also lower, so we can understand that to reduce any lower risks of lower scores during those cognitive assessments, and otherwise, if we do have any hearing concerns, it's also important that we do go for hearing assessments, because if we do pick up that there's a hearing loss, then getting fitted with hearing aids is also important. And if you do have hearing aids, then making sure to go for your annual checkups, because if there are any changes to your hearing, then it's important that we match your hearing aids to exactly where they need to be and where they should be, so that you're not putting in any excessive more cognitive strain if there has been any changes. Yep. So 3 key messages. So 1, we're seeing that hearing loss doesn't just affect the way we can hear, but can also affect our order or our well-being. 2, we found that there has been a strong correlation between hearing loss and cognitive decline. And 3, it's important that if we do find that there's a hearing loss, to reduce the risks of dementia or cognitive decline, it's good to get hearing aids fitted as well. Good. And if you have any questions, then I'd be very happy to answer them after Tony's presentation. Thank you.
So Kay asked me to, I think, talk about maybe how eyes might relate to dementia as well, and consequently I'm not going to do that. So this is going to be obviously about eyes, but I will try and keep it to the theme of general health and wellness, and we'll try and also keep to the topic of brains and heart as well. But I'm going to talk about eye exams, and it's not just always about glasses, and it's not just about me going 1 or 2 constantly. We do a few other things in an eye exam, and one of the reasons why eyes are useful for I guess, relating to general health, as we can see blood vessels, and we can see, I guess, to a degree, nerves as well, and hence diseases and things that affect the rest of the body can sometimes show in the eye. These days with eye exams we've got more equipment to show parts of the eye, so we mostly take photos, and this other thing is called an OCT, which will show slices through parts of the back of the eye and can show a bit more detail. So what I was going to do is go through a few cases of people that we've seen recently that have perhaps general health conditions that might have been showing up in the eye. This one actually isn't the correct photo, technical difficulties, I couldn't get the photo, but this was a lady who came in for a routine glaucoma check where we'd normally just check pressures and update her medication. But we found a few problems at the back of the eye. I don't know if you can see very well in the photo, but there's blood vessels there and some of them are leaking. There's bits of red stuff and white stuff which aren't meant to be there. So we checked her blood pressure, found it to be 210, I think, on repeated measurements. And that's obviously a little bit high if you want to stay upright. So we went through her GP, and she ended up being treated in the hospital. And I think is now doing just fine. So the next case was also one where we were looking at the optic nerve. This lady was in her mid-40s and had a number of unusual symptoms, which I'm not quite sure where she ended up, but anyway, we saw her eventually, and that was relating to double vision. She actually had very normal vision. She could see just fine, but was starting to see two of things. So she had a lot of swelling at the back. Don't know how well you can see there, those pictures, but the one on the left is the before and the one on the right is after she was treated, and the graph sort of shows thickness of nerve tissue. And in the one on the left you can see there's a lot more swelling, so something is pushing the nerve from behind, and as it turned out she was sent off to the hospital fairly quickly, scanned and found to have a lot of blood clots on the brain, which may have been linked to the oral contraceptive pill, possibly. Anyway, she was treated and found to be doing really well. So the next one was another swollen nerve. This is a guy we know quite well. He actually phoned us at home as we were leaving to go on a ski trip and said he'd sprained his eyeball, which, yeah, obviously was not a common symptom, but luckily my wife was there. She took it more seriously, and so we got him in after hours, had a look, and found he had one swollen nerve, which we thought might have been EMS, but turned out to be even more unusual, this thing called anti-MOG. So again, that's treated with steroids, and he's now doing quite well. This one's kind of interesting, relating to general cardiovascular health, which shows blockages in the veins, and it was an unusual one because both the son presented and then the father a few years later, so there may have been some genetic component to that. Both the father and son were quite competitive sports people and training incredibly hard, didn't drink a lot of water while training, which can thicken blood, raise blood pressure. In this case, the particular anatomy meant that they ended up with a vein blockage and burst vessels bleeding inside the eye. So both of them ended up getting treatment, and again, things started to resolve. Although, in terms of the vision, both of them have ended up with some vision loss as a result. Other general health type conditions we see in eye exam, skin cancers, that's one earlier in the year which is treated. I don't know again how well you can see, but the insert photo is the lesion beforehand, and afterwards it's removed. There's a couple of purple stitches you can see there. Melanomas, we don't really see many skin melanomas around the eye, but weirdly, I've seen two inside the eye, which is a bit unusual. We don't see many, but and even more weirdly, the one on the left actually turned out to be not a melanoma in the end. even though it does look way more scary than the other one. And this one here, I don't know if you can see that very well, but the one on the right was taken just a few weeks ago, and the one on the left was maybe a few years ago. This guy's about 42, and then there's a little white spot that you can see just on the bottom of that picture, which we thought might have been a cholesterol plaque. And yep, so normally when we see that, we'd send people to their GP for cholesterol workup. Turns out he actually just been, and his cholesterol was in fact raised. So we didn't really help him out much there, other than just validate that sometimes we can find things that are useful. So the interesting thing, I guess, in terms of the future of this is some of those things are quite hard to see. AI seems to have a lot of potential for looking at these images and finding things we can't find, and AI is built up of data sets. So basically you feed AI the entire internet or lots of iPhotos, and it eventually starts to learn things. So the interesting research in AI and iPhotos is they can now tell the sex, race, age, blood pressure within about 10%, just from looking at photos. And the new thing is relating to the dementia thing, potentially in the lab at least, early signs of dementia from iPhotos. Nobody quite knows how the AI is doing it, but it seems to be able to predict this reasonably well. So it's not clinical yet, but maybe one day. So I guess in summary, eye exams, yeah, sometimes have a few more things going on relating to general health. That I think is, that's me. Hi.
You had an image up there that was, could have been a pre-indicator for MS. MS is multiple sclerosis.
Yes, yes.
Oh, yeah.
Yep, that was the chap with the sprained eyeball. Yeah. I don't know if you want to see it again, but yeah, that was a swollen nerve. So the sprained eyeball came from when you move the nerve, move the eye, the swollen nerve creates pain. And in his case, it was one eye, which is what you'd expect. And the difference with the other swollen eyeball, the lady with the blood clots in the brain, is she had both nerves swollen and lots of bleeding and hemorrhaging. So they do look a bit different, these things, but they get treated the same by us, which is they get sent off for a head scan.
Can you also get edema swelling in those veins in the eye, the retina, that just sporadic and go away?
You can get swelling of the nerve that is called idiopathic. We don't know what it is or why sometimes, but that's pretty unusual. And you'd still have the same workup. You'd still going to end up as a head scan.
What about floaters? A lot of people say they see
Yeah.
floaters. What's
Yep.
that caused by?
Okay, so floaters are the internal part of the eye, is a big jelly thing, and as you get a bit older that breaks up into bits and you start to see them drifting around. They can relate to general health sometimes, not often, but sometimes, and I didn't have a good slide of that one, but you can get cholesterol forming as floaters in the middle of the eye. It looks like a snow globe when we look in, it's quite spectacular. Again, we'd send them off for a cholesterol workup. Most people already know by that stage. Hello.
Tell me, what's the treatment for melanoma in the eye?
So, yep, you'd strap on a radioactive plaque on the back of it normally. And I think these days that's similar outcome to removing an eye, which is what used to happen. Yeah, it's not a brilliant thing, but that's normally how you'd treat that. The one that looked really scary, that was actually sent to a couple of different eye specialists, and everyone was going, this is a melanoma. It eventually got to one that was a specialist in melanomas, and he thought it wasn't. So
didn't actually end up getting treated, and it turns out it wasn't. So, and he actually biopsied it, which was what that big hole in the middle of it was. So.
What's the life expectancy without treatment?
Good question. Don't know. Probably not that long. Hello.
Yeah, hi. She spoke about floaters.
Yes.
Are those the ones that look like fibers?
Yes.
When is it a concern? Because
Sure.
I do have floaters.
Yep.
I'm concerned of that, but
Mm-hmm.
when is it a...
So it's a concern when they suddenly change. So if you get a big dose of new ones that were not there all of a sudden, you'll see them more when you look for them. White ceilings, blue skies. They're probably more normal ones you've had for years. But a sudden burst of new ones, maybe with other weird symptoms. Yeah, anything you're worried about, we'd check it out.
What do you mean by weird symptoms?
Yep, so maybe some weird flashy lights and other things going on at the same time. If you're quite short-sighted and you're younger, it's more risk. As you get older, everybody gets a few more.
Julia, so just with hearing aids, I feel like there might be a lot of stigma attached to those who might need hearing aids. So I'm just wondering, what's been your experience in the clinic with those who might have that stigma? And yeah, what's kind of your approach to that?
The kind of stigma would be if it's about aesthetics, then there are different styles that we do also fit for more discreetness. So definitely it would be trying to get the best available style for you and seeing how it affects, how it also matches with your lifestyle and things like that as well. So we can definitely look into different options there. Is that the kind of thing you were asking about?
Obviously, I'm not an elderly, but those who might be an elderly and get hearing aids might think it might be some form of disability that people might perceive it to be. So, yeah, maybe just like your approach to how you would comfort them and encourage them to get it.
Yep, so I think also hearing aids aren't just for elders, but even though we do see that it's more prevalent with older populations, people even as young as babies at 6 months old get fitted with hearing aids, and we're seeing that as hearing health awareness gets more prevalent, that more people are also getting fitted earlier on as well. For example, people in the military also do get fitted with hearing aids a lot earlier on too, because of noise-induced hearing loss naturally. Yeah.
What do you think of the iPhone AirPods type system, just for home checking?
Yeah, I think that's an excellent system. It's really good for people with mild to moderate hearing loss. They also do those screening tools, your hearing tests on the iPhone as well. But if you want an accurate test, you can always ask your audiologist for one, and then they can also match it there. But if your hearing loss is more profound, probably not the best option to go for. But definitely good to start off with if you're a little bit worried about investing that much into hearing aids. Yes.
Question for you,
Oh,
Julia.
yes.
You mentioned that, or you encourage people with hearing loss to get fitted for hearing aids,
Yeah.
to obviously reduce all the other health implications. Would you, I guess I'm wanting to understand what level of hearing loss would you be recommending that? Is it for the ones that have the mild, it doesn't really impact them day to day, or is it more when it gets, I think the next level was moderate?
Yeah, that's a really good question. So for the same amount of hearing loss, a lot of people actually have different lifestyles. So for example, if it's more challenging, they're needing to be socialising in a lot of situations. If they're working full time, constantly going to these conferences and social events, then yes. Even for someone with slight to mild hearing loss, we definitely fit them with hearing aids just because we want to reduce as much cognitive effort as possible. But for the same amount of hearing loss, if someone has a quieter lifestyle, probably not, just because they're not using as much of that cognitive effort day to day. Yes.
Julie, is it inevitable with age that one loses high frequency hearing ability across the board?
Yep. So definitely, as we age, our hearing does deteriorate naturally. So definitely, like you mentioned, high frequencies start to deteriorate. More so, yeah. And then the low to mid pitches, yeah. Just because there's more wear and tear in those pitches there. Yes.
So, do they make hearing aids that look just like AirPods and can actually double as AirPods?
Yep, that's a good question. So lots of styles have become available. So like you mentioned, the AirPod style, so we do custom ones that look exactly like Samsung earbuds, for example, that do have that Bluetooth capability as well. So if you're wanting to listen to music, phone calls, and podcasts, for example, through your hearing aids, they double as the feature while also improving your hearing at the same time. So lots of younger populations do like getting fitted with that kind of style there, yeah. Yes?
Do you find that the price of hearing aids prohibits people from even investigating that sometimes because they perceive that they're a very expensive option?
That's a good question as well. So definitely hearing aids are a big investment. So once you have a pair of hearing aids, so like you mentioned, hearing aids range in price. So the more affordable ones definitely we do fit if you're just needing amplification, and the higher tech ones like you mentioned that are on the higher range are more for those kind of extra features that you're wanting. So for example, rechargeability, Bluetooth capabilities, AI noise suppression features. If you're not needing all of that, then you'd be looking at the more affordable ones. And also, work and income are really helpful in those situations as well. They do supply loans, and if you are, and it depends on your funding as well. If you're currently a community card services holder and you qualify in one of the criteria, then you are eligible for free hearing aids as well. And we are also partnered with the National Foundation of Deaf and Hard and Hearing, so we're doing different projects in the background to fit people who can't afford hearing aids but really need hearing aids as well. So we've been getting a lot more intake to fit free hearing aids for people who really need it. Yeah, so that's a really good question. We're trying to remove that barrier as much as possible. And even for people day to day, we are doing free to hear hearing aids for people who can't afford them as well. So if that's something that you might be wanting to consider, then you can also mention that to your audiologist. Yeah.
That's good.
Yeah.
Any more questions? No? Okay, nothing. All right, well thank you to Tony and to Julia for their time and their expertise. It's been fabulous to have you today. One of the 8 businesses in Beacon that are in health and wellness space. So please come visit them if you need either of those things. And please thank them for their time today.